The Surgeon General's report came out in 2000, and essentially it said that we have a silent epidemic in healthcare, and that is caries across the lifespan, and it's unattended to. And that really began to change everybody's thinking about how we think about oral health and how we think about improving oral health.
In 2007, I can still remember reading this story in the Washington Post of Diamante Driver. He was a 12-year-old boy who had had such significant bacterial infection that went to his brain that was caused by a tooth abscess. So he had oral health problems and suffered with them for a long time before anybody recognized how severely sick he was. So the systems weren't there for that child. The opportunities weren't there to relieve his suffering. And from the tragedy of his death came an opportunity for change in Congress, where they started to see that if this kind of thing was happening, it was an outrage. We needed to stop it.
So we decided, based on recommendations from the Centers for Disease Control, that the best way to improve health is to focus on prevention and to focus on kids in school, because in elementary school you have a 6-year, more or less, time frame, and it's while kids are beginning to learn to read and write, while they're learning self-efficacy, while their teeth are changing from baby teeth to permanent teeth. So you have an opportunity really to change the oral ecology if kids have cavities from a disease pathology or a disease environment to a healthy environment for a lifelong trajectory.
So the Children's Dental Health Project really works on creating policy opportunities and providing technical assistance so that care is available and accessible and affordable for families. So there are a lot of great organizations that are doing direct care. They're working with parents, they're educating them, they're making sure kids get services. We want to make sure the infrastructure is there, that the systems are there, and that there is a buy-in by levels of government, by anybody who can invest in it, in making sure that good oral health care is available.
Having that research background made us think about how do we measure outcomes. So we really asked 3 questions at the beginning. What is the problem we're trying to solve? What are we going to do to solve it? And how do we know that what we did really was an improvement?
It's amazing, but for many, many years, probably most of our healthcare system's kind of existence, the mouth has been outside of the body. So any concern about the health of a person, be it a child or an adult, has not really considered what happens to a child's mouth.
According to the Healthy People data, in the US, about 30% of kids have untreated decay. And it turned out when we went into the first 6 schools, 67% of kids had untreated decay. And by doing comprehensive evidence-based prevention twice a year in schools, we were able to take that number from 67% down to 21%. So we exceeded the Healthy People 2020 goals prior to 2010.
What's really critical for us is unrestricted funds, funds that allow us to do the kind of, quick move policy work that we need to do, or respond to a technical assistance request, to be nimble, to be responsive to opportunities so that we can continue to expand care. And the Dental Trade Alliance Foundation gave us 2 grants that really helped us do that in critical junctures in the whole policy debate area.
The DTA provided seed funding at the outset to get us off the ground so we could begin to survey the schools in Massachusetts, figure out what we're going to do, essentially give us a big boost and a vote of confidence.
For the first time, instead of declaring health, the organization doing